Welcome, everybody. So great to see you. Well, I don't really see you. I see your initials, but I know you're there behind those initials. And thank you for being here um, for this today's webinar. Whether you're from healthcare, banking, adult protective services, law enforcement, aging programs, or community advocacy, your presence matters because elder justice in Texas is not the responsibility of one profession. It is a shared commitment. Financial exploitation is the most prevalent form of elder abuse in Texas, and older adults across our state report a lot of losses each year. Behind those numbers are real people, retirements erased, homes refinanced, savings accounts drained, and often deep emotional trauma that lingers long after the money is gone. No single agency can stop this alone. That's why the Texas Elder Justice Coalition brings sectors together. Participation is not passive, it's powerful. And I will now introduce Anna. She was the section manager. Anna Thomas, let me start over again. Anna Thomas was the section manager of the Division of Aging Services Forensic Special Initiatives Unit, and most recently a forensic specialist with the Georgia Bureau of Investigation Crimes Against Disabled Adults and Elderly Task Force, or CADE. CADE's mission is to protect older adults and adults with disabilities from abuse, neglect, and exploitation, and to prosecute offenders. Her work with the CADE Task Force centered on training primary and secondary responders how to recognize and respond to at-risk adult abuse, researching gaps in current victim services, developing new laws and policies to protect vulnerable adults, and public outreach. I'm not even going to do that right now. So with that, Anna Thomas, we are so thrilled you're here. And we will hold questions we'll hold questions then. I'll turn everybody on camera and unmute mics. But in the meantime, put your questions or comments in the chat.
All right. Hey, everyone. I'm Anna Thomas, and I am the Executive Director for the National Center for State and Tribal Elder Justice Coalitions. First off, I'd like to thank Dana and thank everyone with the Texas Elder Justice Coalition for inviting me. You may not know it, but I am one of your biggest supporters. I'm so proud of the work that Texas has been doing the past few years, and I'm looking forward to see how this coalition continues to grow and continues to do the great work. Dana, can you see my screen okay?
Yes.
Okay, thank you. Caveat, I've had a terrible technology day. I'm just going to say, like, it has not been a good Monday for me. I think it's a sign. So hopefully this will go smoothly and we'll see. So as I jump in, a couple of, I guess, housekeeping caveat kind of things too. You may have seen this presentation at a national conference or online before, and you'll say, oh yeah, I remember this. I remember this. That's very intentional. Me and the partners who teach on this try to keep it as succinct and as similar as possible. And reason being is because if you're sitting across someone at an MDT meeting or at another conference and this topic comes up, you guys already know, you already have like the same knowledge. You both saw the webinar, you both were at the talk, so that you don't have to go through and try to get the backstory and explain, oh yeah, this is what this is. You're starting from a point where you're both level set. So if you've seen some of this before, hang on, because there's always a little nugget of something new that you'll grab. But also we're going to go through and level set as well. If you haven't seen this webinar before or haven't even heard about what benefits trafficking is. So hopefully, Dana, are you seeing a map of the United States? All right, it's working, fingers crossed. So this started, and the research on this originated in Georgia. That's where I used to work. I live in Missouri now, but it started back in Georgia, probably probably around 2015. And we started recognizing a pattern. Law enforcement was telling us they were seeing this pattern of unlicensed homes and unlivable conditions, and I'll go into more of that here soon. And we kind of got the pattern going together. We found out it was a form of trafficking that was happening around our state. So we got a law together, all that great stuff. But then we started talking on it nationally, and so many other states came up to us, the states that are in purple here, and said, oh my gosh, we are seeing the same pattern, but we didn't know what to call it. We didn't know it was trafficking. And you see like the light bulbs going off when you're talking to people about this. So these are the states that have already identified it. As you see, your state is one of them. Y'all are doing great work there in your state of combating this type of trafficking. But I see these gray states, right? And I know, like in my heart, I know it's happening there. It's just they haven't identified it there yet. So if you come back a year from now and we're doing this again, I guarantee we'll have more states filled in. It's just kind of the way this game rolls. So welcome. We're going to do some level set. I'm going to talk through some case examples. I love teaching using case examples. I feel it's the best way for us to learn, so walk through some of these crime scenes together. And then we're going to talk about the possible roles of elder justice coalitions. And if you are, whatever context you're coming into this meeting as, APS, law enforcement, prosecutor, provider, whatever you do in this field, there's something, a takeaway that you can take from this. If you are part of the Elder Justice Coalition, you want to be a member of the Elder Justice Coalition, or you just want to take this back to your team, back to what your role currently is, there's going to be something for you to choose from at the end of the presentation. And I'm going to go too fast, so let's do this. All right, let's level set. So we're talking about benefits trafficking. So first we got to figure out, what are benefits? What do we mean by that? So umbrella term, as we say, benefits, but really it's any sort of government assistance that a person can receive. That can be Social Security, food stamps, SNAP, unemployment, retirement even falls under this, or VA benefits. So any type, just think of any kind of check, any kind of card, any money that a person is getting that is, coming in for, like I said, retirement benefits, anything like that. That's what we mean when we say benefits. Then we got to talk about, what are unlicensed homes. You'll hear me call this an unlicensed personal care home, or this happens in unlicensed homes. And I've learned that every state calls them something different. So when I talk about an unlicensed personal care home, let me say that it's not a business license that we're talking about. I'm talking about a license from the state. Every state has an issuing agency that licensed assisted livings, that type of thing. And that's what I mean when I say unlicensed, common misconception. So what it looked like in Georgia, and I'll use some of our Georgia terms, it was a home, single living home, single family home. About 5 to 15 people are warehoused in a home. They're neglected. The owner, who you'll hear me call the trafficker as well, the owner of that unlicensed personal care home is taking the money from the people, taking the benefits, putting it in their own pocket, and not providing any services, not providing the care, the services, the meds, the food, everything that was promised to that individual. And the owner uses it for their own good. Oftentimes, these residents, they can't escape once they come into these homes. They're either locked in, they're threatened, coerced, and there's no way of getting out. They don't have a cell phone to call family. They oftentimes just aren't able to even move around the house. They may be locked in a basement, an attic, room. So you'll hear me kind of use these terms and talk about this as we talk about what benefits trafficking is, or trafficking of senior adults, and what it looks like. I've learned, like I said, everybody calls it something different. So on the screen, I've got a few of the terms that I've heard from people around the states. So unlicensed personal care home, that's Georgia. I've also heard group home, a transitional home, a house of the Lord, a house of God, and there's, unfortunately, this makes me mad more than anything, is that there is a religious connotation to a lot of these houses. A sober living home, an assisted living facility, or assisted group home. I've heard all of those different types. So we're talking about these homes. Again, remember, they're under the radar. They're not licensed. So, we're not talking about a nice memory care unit in an assisted living facility. Talking about something that, a facility, a house that does not have any licensure. It's really, really under the radar. So hopefully your wheels are turning and you've said, yeah, I've been in a couple of those houses, or I know exactly what she's talking about. Then we got to talk about trafficking. This term, we kind of like know it when we see it, right? And we always think about sex trafficking when we talk about trafficking. And that's good because there is a trafficking model, a human trafficking model that came from all the great work that was done with sex trafficking. But we also know there's labor trafficking, human organ trafficking. So this model, this human trafficking model set by the Department of Justice, and it really gives us an idea of what trafficking looks like. So that way we can easily identify it. And if you've ever done any work in the human trafficking space, this is probably familiar to you. It's been around for a while. So you have the act and the means and the purpose. The act is what we typically think about, right? Somebody's recruiting, maybe recruiting a young girl, a young runaway to come be a model or to come work for them, be a dancer, right? You kind of think of that type of recruitment, that idea of selling a better life. Like, come get off the street, come live with me. I'm going to take care of you. So how do traffickers do this? They may recruit, they may pick a person up and transport them somewhere else, transfer them from state to state, county to county. There may be a person on the other end that receives those individuals and holds on to them, harbors them. So what are the means? How do these traffickers do it? They threaten, they coerce, there's false promises, come live with me, you're going to make a lot of money. I'm going to get you out of this life. I know your parents are mean to you. Come stay with me and I got you. But there's abuse of power and there's a lot of fraud and deception. And then the purpose. So why do traffickers do this? As you know, it's for sexual exploitation, could be servitude for labor trafficking, forced labor, just across the board, any type of general exploitation. So hold on to that model. We're going to overlay it onto the victims that are of benefits trafficking. So senior adults, adults with disabilities, and adults with mental health concerns. So the benefits trafficking model looks very similar. A couple things you'll notice that are different is the ACT. The ACT is recruitment and referrals through very legitimate ways, through the local hospital, the local mental health hospital, through the VA, through homeless or unhoused shelters, through domestic violence shelters, through churches, online, and also through other licensed facilities. The means are very similar. Lots of promises of life is going to be better for you. You come stay with me. I've got 4 or 5 other people that live with me. You'll have friends. You won't be alone. I'm going to take you to the doctor. I'll get you the medicine that you need. We're going to have food. We're going to have snacks. We're going to go bowling. It's going to be great. And there's that idea of brainwashing. Like, hey, come live with me because it's safer with me. You don't have family taking care of you. No one's here to take care of you. I'm going to be your family. And as you can see, the traffickers and the owners of these homes slowly get into the trust of the victim. And the trust is built quickly because the trafficker is a con artist and they know the right words to say. And the purpose, you guessed it, is for the benefits that are attached to that person. Not for that person. They don't care. They don't care about the person. The trafficker wants to make money. And all that money that they take from the individual, and Social Security, for example, let's say $700 a month, goes into their own pocket, not to the individual. It goes into the pocket of the trafficker, untaxed, under the table money. So I hope you're getting an idea about what we're talking about here. This is a difficult illustration, but hang with me for a minute. When we were doing this work in Georgia, we found a common flow because we got tired of trying to be reactive to these homes. We really wanted to be proactive. And how can we stop the flow of people going into these unlicensed homes? So we came up with a pattern of how are people getting in there? What does the funnel look like? So again, hang with me for this. So you've got the trafficker, right? The mastermind, the trafficker. The trafficker goes to the hospital and says, here's some donuts. Hey, I just want to introduce myself. I own this personal care home. I always have a bed open and I need you to call me. Just call me when you have somebody that's so hard to place, or maybe somebody that, they'll say APS isn't doing anything. Just give me a call. I've always got a place for them. Here's a flyer. Here's a brochure. Here's my card. And they start to gain the trust of the hospital discharge planner. As many of you know, trying to discharge someone or being a hospital social worker is not easy. And they are constantly overwhelmed with a lot of pressure of trying to turn a bed. So the trafficker, sounds like a great idea. And the discharge planners don't know they're discharging someone to a bad situation. The trafficker just seems like a really nice person who says, hey, I'm doing this out of, the goodness of my heart. And I really want to help these people. So next time there's another person at the hospital that the hospital can't place, is having a hard time finding a place for them, they call that trafficker. They call that owner of the unlicensed personal care home. And they say, can you come get this person? And of course they always can, right? They always have that open bed. So once those people go to the trafficker, and we'll say the 3 people here on the screen, the trafficker takes them to the first house. That's the main house. And kind of triage, see what kind of care they need and see what they can do. Can they take care of themselves? How much money do they bring in? Are they going to be worth my time? Do I need to send them somewhere else? Do I need to exchange them with another trafficker because they're too much of a headache for me? Or can I really get some good money out of them? So then they'll move them. The trafficker will move them to their other homes, or again, trade them back and forth, keeping that bed empty, keeping those beds empty so that they can always take in another person. So from what I've heard, from what I understand, what I've seen is that it's like, I'm not a rancher, so spare, please give me some grace. But it's having like heads of cattle. The more heads of cattle you have, the more money you're bringing in. And that's exactly what these traffickers are doing. So common themes, again, this is important if you're doing any work in the field. I want you to be able to know what to look for when you're out there. Let's talk about the financial themes. You'll see the residents don't have access to their own money. They don't have access to any sort of bank account, debit card, any sort of their benefits at all. The trafficker's taken all of that from them. And the trafficker is the rep payee. And y'all know how easy it is to become someone's rep payee. So the trafficker will often become the rep payee of those 5 to 15 people in the house. The victim is supposed to have one bed to themselves. They may have a bed. They may just have a pallet on the floor, or they're sharing a room with a bunch of people. And then the trafficker is charging for services. Now, how is the trafficker going to charge for services when these victims don't have any money, right? So if you want to go to the doctor, you got to pay more money. Well, these victims don't have it. The trafficker has all of their money. So let's talk about the victims, and they truly are. And if you've ever met one of these people or have been at a chance to relocate them to safety, they are survivors. They have been through a lot. Their dignity has been stripped from them, and all sort of civil rights have been violated. So the victims, most of them we're finding have behavioral health concerns, along with either being an older adult or an adult with a disability. They're malnourished. They haven't been fed in a long time because food is overhead. The trafficker doesn't want to, spend that money. And they're confused about how they got into this situation. They were living at a shelter. They were doing okay. But then this woman, it's typically a woman, pulled up and said, hey, do you get a check? If you do, come stay with me. And they're confused about how did they end up in this terrible situation, locked in a home with all these other people. I want to share some misconceptions about this crime, and some of you may already be thinking it right now. So I'd like to dispel some of those. I've heard from people, hey, this isn't trafficking. So hopefully you're seeing it does meet the trafficking pattern. You've got the act, the means, and the purpose. And people always think, trafficking, they've got to be moving around place to place. And there is a component of these people moving around from place to place. There in Texas, if you have law enforcement show up at the door at one of these unlicensed homes, and word will spread really quickly that, hey, law enforcement's on the street. These traffickers know each other. They call each other, and they will pack up the people and they will move them into another house, maybe even down the street, down to the next county. So they move them around so that they can hold on to these victims, they can get their money, and so they avoid detection. I've also heard this is just simply financial exploitation. It is financial exploitation, but there's a lot more to it. You have abuse, you have neglect. Sometimes you have assault involved with these cases as well. It's a multifaceted type of crime. Another one is, oh, this is just a civil issue. This person's the rep payee. They have a power of attorney. It's not a civil issue. There are civil rights violations happening, but it is a criminal act that is happening to these people. I've also heard, oh, it's only healthcare fraud. It's just healthcare fraud. Healthcare fraud is part of this because you'll find the traffickers are charging for services that are never rendered. But there's way more than just healthcare fraud. But healthcare fraud is a good way to start the investigation into one of these homes. I've often seen people say, well, if I just shut down the home, it's going to solve the problem. The home is no longer operable. And I say, well, you shut down the home, but where did the people go? And then I kind of get the look like, well, I don't know. So if you shut down the home, where are the people, right? The trafficker has moved them somewhere else. And now we've just lost, 7 people that were in this trafficking cycle. I've also heard this is some other agency's problem. This isn't mine to deal with. And this isn't even happening here. But you remember the map, it's really happening everywhere. And I know that it's definitely happening there in Texas as well. So let's walk through some case examples together. Hopefully this will work. We'll see.
The first time I spotted Mr. Hill, he was walking down Clifton Springs Road. It was just weird to have someone walking down the street with a sweater on, some shorts, carrying a big blanket. So I decided to turn around and have a little chat with him. Hey, you okay? Initially, he told me that he was being held hostage in a basement. A basement? I'm not gonna lie, I thought he probably was a little crazy. But something was going on, and I was like, okay, well, let me see if there's some truth to this. He was able to tell me his name, his date of birth, the last address on his license. So he was coherent enough. And he actually said to me, he said, I know I sound crazy, but I'm telling you the truth. I patted him down before I put him in my car. Well, he actually handed me some bent up nails. So he explained to me that she actually took the nails and bent them to lock him inside of the room, and the nails held the door together. At that point, I put him into the unit, and then we proceeded to drive around so we could try to find the house. I proceeded to ask him, do you know what your house looks like? He tells me no, he's only seen the house once, and that was when she brought him initially to the residence.
Mr. Hill had been in the basement, and he could hear what was going on above him, in the house above him. There was a family up there, there was a dog, and he recognized the bark of the dog.
That could be it right there.
At that point, the dog is barking. He says, this is the house, this is the house. He's pointing at the house. I get out as I make my way towards the residence. I come in contact with Mr. Wheeler. Mr. Wheeler was dirty. He had a lot of, crust and stuff on his face like that. He was walking very slow. It looked like he was malnourished.
And she asked him, who lives in this house?
Do you live with someone in the basement?
And that's when he told her that there was another guy, but he had busted out that morning. And she realized, wow, that this maybe this is true.
Is this Mr. Hill? He came over, identified Mr. Hill for me. At that point, I asked him to show me where he was, staying in the basement. He proceeded to walk me around the side of the house, and we came to a door at the back of the residence. When I saw what I had, I called for some units to help me secure the location because it was a pretty big house. I called detectives, crime scene out so we could get a search warrant, make sure everything was processed legally. So the chain of custody was there.
It was so wonderful that she thought to get a search warrant, to bring a detective to the scene, to bring crime scene out to the scene, to take the photographs and to do everything properly. And that means it was all recorded, and I was able to use it as evidence.
While we were out here investigating, the spouse actually pulled up into the driveway. She was in an Escalade. Her daughter was in the passenger seat. At that point, I did transport her down to CID headquarters.
This is Detective Russell. I'm out at Clifton Springs Manor. I'm out with Johnny Ray Hill. What's the living conditions like where you were staying?
The door is locked all the time until she comes in to feed her.
Okay.
Which is twice a day.
What about sleeping? What do you sleep on?
One single bed. You should see his damn bed. That looks like a damn trampoline for a kid.
What about shower?
It's an aluminum bowl under the table there in the room.
She fill that up every day?
No, about every 2 weeks.
What about restroom?
It's a tank bucket, discarded tank bucket. That's what you do 1 and 2 in. Peeing and shitting.
Okay.
And that's it.
Anytime elderly or disabled people are exploited, it's always about money. The detective was looking not just to see what was happening in the basement, which is where the 2 men were living, but they also searched the upstairs. He found a bank statement that had Johnny Hill's name on it and also had Chandra Faust's name on it. And she had actually added her name to his bank account and that's how she was able to spend all of his checks. And we have actually had photographs of Chandra Faust accessing his funds. Now, did you ever talk with her about putting her name on either one of your bank accounts?
Absolutely not.
Did you ever let anyone else have permission to take money out of your account through a debit card?
Absolutely not.
Or did you give anyone permission to write checks on your account and take your money out?
Absolutely not.
The grand jury indicted Ms. Faust on false imprisonment, exploitation of a disabled adult, 2 counts of abuse of a disabled adult, and also 2 counts of theft by taking. She was sentenced to 20 to serve 10, and that means 10 years in custody, followed by 10 additional years on probation.
It felt real good to see Ms. Faust go to jail for what she did. To take someone's freedom from them unwillingly, to me, is very bad. But crimes against elderly people who can't help themselves, she was praying for her own financial gains.
I think the most important thing that Yolanda did was give him some credence. She listened and she investigated what he had to say, even though it sounded a little bit crazy.
I think Officer Shields is an excellent example of what a police officer can do and what a difference they can make. You know, going with that gut feeling that something doesn't feel right and pursuing it until her concern is satisfied.
Elder abuse is occurring pretty much in every city and every county in Georgia, along with throughout our nation. If there's financial exploitation occurring, then usually there's either abuse and or neglect occurring at the same time.
Mr. Hill went into a much better place. It was paid for with his check. It was not a homeless shelter and it was not somebody's basement. I went to see him there and he was very happy. He was able to tell his story and he didn't have to tell it from beyond the grave like he thought he might.
All right, I know that's hard to look at and hard to sit through, but it gives a great idea of what we're talking about. And you can find this video on the Elder Justice Initiative, but also on EAGLE, the Elder Abuse Guide for Law Enforcement. It's free for anybody to use, to download, to use as a teaching tool to take back to your department. And it really does encapsulate everything that we are talking about here. Now, had this case happen sooner, or excuse me, later, we would have been able to charge her, the trafficker, with benefits trafficking. So we actually crafted a law specifically for this crime. But at the time that this happened, that law was not in place. But these cases, just like this, helped us realize we needed a specific law about this type of trafficking. So you saw in the video, this is where the gentlemen were being housed, and they were being held against their will, and you saw the bowl under the table, that was their shower. But they were also very smart gentlemen. They just fell on some hard times, made some difficult choices in their life, and ended up in a place that they never thought they would. So they had a little TV you can see there on the left, and she kept the TV on all the time. She called that the babysitter. And, you know, there's those channels where like CSI is on all the time, like 24/7. That's what they kept it on. And so, you know, the gentlemen, both of them were saying they're very smart. But Mr. Hill said, you know, I thought I was going to die down there. And so I pulled out a piece of my hair for every day that I was held down in this basement because I know about DNA. I watched CSI and I wanted somebody to know that I was down there. So when they're executing the search warrant, he said, I hid it under the lamp. You can go find my hair under the lamp. And there they found a clump of his hair. Just illustrates how many days he was down there and also what a smart man he was. And that this could really happen to any of our older adults or adults with disabilities in our communities that, you know, don't have the resources, don't have the family or friend support to be able to take care of them or take care of themselves. So I want to talk to you about another case that happened in Metro Atlanta. It's called Operation Mercury. And the timeline for this was there were all these 911 calls coming into the 911 center. And it was like residents were fighting. These people are fighting. They're calling saying, we don't have any food. And 911 is like, what is happening here? You know, of course, they dispatch an officer out there. The officer goes out and finds an individual who is in the home along with several other individuals. And this person had a key around their neck. And they could tell that this person needed care as well. But he was in charge of everyone else. And that is a common theme. You'll find a person that has a key in their pocket around their neck, and that's the key to the front door or to the medicine cabinet or to the refrigerator. So we kind of termed this, we kind of coined this term, a keeper of the key. So officers find this gentleman, keeper of the key. He's like, we haven't seen anybody here for a while. We need food. these people are fighting. The people living in the house with me are fighting. I don't know what to do. So smartly, Uniform Patrol called the detectives out to come and look at the scene and figure out what was going on. And detectives get out there and figure out that these individuals haven't had food for days. So no wonder they're fighting with each other. Plus, several of them needed mental health medication that they weren't on because the trafficker wasn't giving them the care she provided or she said she would provide to them. And they also found lots of rep payee, like Social Security rep payee abuses. She was the representative payee for all the people in this home and several other homes that she had on the same street and around this county. So she was really managing, I use that term loosely, the money for all these victims. And she was buying food for her family. She was going on vacations with this money and leaving them without anyone there to care for them. So these are some of the exteriors. You're probably thinking in your head, like what these homes look like, right? You might have been to some of these homes, but I wanted to show you what the exteriors look like because they just look like normal homes that you would find anywhere. You wouldn't know what's going on behind these closed doors. It's not like there's a big glaring sign that something's happening here, and you don't know until you get inside. And they are just hidden in plain sight in neighborhoods all throughout. And you just don't know what's happening until those 911 calls or until someone dies or until these houses are discovered. Again, just regular looking houses, but then you get inside, right? And I know many of you have been to places like this if you do field work. You get inside and this man was lucky he actually had a bed, but a lot of individuals don't. They don't have a dresser, they don't have a bed. And they, you'll see like curtains that are put up around basements to try to divide the basement into these little cubbies for people to stay. So this is one I wanted to show you because I'm sure y'all are sitting there looking at like, why is she showing us this random bed? There was a gentleman that was laying in this bed, very concerned when we walked in because I saw cigarettes and I saw an oxygen tank. So I was like, okay, let's back out of this real quick. Let's make sure this is all secure. But he was locked in this room. It's 2 ways to get into this room. There's padlocks on the outside of both of those doors. And you can see there's urine, feces on the bed and the little containers of food there. That was all he was given to eat. He had a really bad heart condition, had to be taken to the hospital by ambulance once we were doing this relocation. But that's beside the point. Like he was locked in here. He had no way of getting out. He couldn't really move around. And he's there smoking with oxygen. So all the other residents there are at risk, but he was really malnourished. And so I encourage you, if you walk into any of these homes and you see a lock on the door, get in there as soon as possible, because for your safety, but also for the safety of the people that may be locked behind those doors. And look for locks anywhere in the house that you really think locks shouldn't be. On the outside of doors, on the refrigerator. Again, the traffickers are going to keep that overhead low and they're going to lock up the food. You bust those locks open, most of the time there's not any food there. You see this refrigerator here, it was made to, I think there were 8 people in that home and this was their food. This was all they had. And as many of you may know, what is living in all of these mattresses, a lot of bed bugs. I took this picture, but I zoomed in, like I was nowhere near close. But each of these mattresses represents a person that was in this single family home. And it's just heartbreaking to think that many people were locked in and shoved into this home and being exploited, being trafficked. So now we've laid it all out. This is what we're looking at. This is the crime. It's happening everywhere. So you may be thinking, well, I'm just me. What can I do? Or I'm just in my organization, my agency. What can I do? So I want to give you some possible roles here. When we're talking about coalitions, you guys already know what a coalition is, but the National Center has come up with a working definition. And the important part of this definition is what's underlined there at the bottom. You don't have to be a coalition to be doing coalition work. Some people call themselves networks, task forces, councils, partnerships, associations, a lot of different terms, but they tend to do the same work in addressing policy and practice related to elder abuse detection and prevention, but also intervention as well. And that's what we're talking about here. So I want you to grab your pen, not if you're driving, but grab a pen and paper, grab your notes app, and write down one of these things that you think you can do in your role, your current role, or that your organization can do when it comes to benefits trafficking. So the first thing is advocacy. Be the person in the back of the room that raises their hand and says, hey, what about older adults? Join a human trafficking organization or task force in your state and be the one that speaks out about this. Say, hey, I learned in this webinar that older adults are trafficked too. Can we talk about that? Advocate for better oversight. Advocate at the state level if you can, and not lobby, but educate and advocate for better licensing procedures, for better oversight. Make invitations. If there's a human trafficking task force there in your state, invite them to come talk to you. Invite them to come to your next meeting, to your next training session, and say, hey, there's another type of trafficking out there. How can we partner? How can we work together to really protect everyone that's involved in human trafficking? Not just sex trafficking, not just labor trafficking, but benefits trafficking too. And I say be the one that makes a difference. Be the one that really raises the alarm for this issue. Legislative education. You can form a legislative work group. Evaluate what laws you have on the books. See if maybe they need to be tweaked a little bit, but maybe there's some new laws that need to be passed. I know this is a hard legislative year for a lot of states. It may take a long time. And we had the law that you see here on the screen, which was 16.5.102.1 in Georgia, and that's our benefits trafficking law. We currently have Maryland also has a law against this as well, and we help them with their law. It's not easy. You know, if any of you have ever done legislative work, education, advocacy, it is not easy. And it takes time. You know, you may not get it passed this year, it may not be next year, but keep at it because you can definitely do it. Number 3, partner education. So as we are sitting here today, who in the coalition or who of your partners, like your community partners, do you think need to know about this? And how can you share that information with them? And I put a few on the screen that we found really valuable. So code enforcement, definitely. Non-emergency medical transport. Like who's transporting these people from the hospital to the trafficker's house? Sometimes it's the trafficker. They'll come pick them up, but it could be non-emergency medical transport. They may be able to tell you which houses they go to more often than not. Think about your homeless or your unhoused advocacy groups. They are great to know about what's happening here because they can help prevent this from happening. And public health too. It is a public health issue. You can also get some really good data from public health at times. And then form a subcommittee. You know, maybe you feel like I can't do this on my own, but I know there are some people that can, and I need to get them all in the room. So form a subcommittee. Who's in that room and who's at that table? Everybody. So definitely the heads of the agencies, but I want worker bees as well. The worker bees, the people that are boots on the ground, they are the ones that are seeing this. They are the ones that can inform you about what's happening, where it's happening, and good ways to prevent it from happening. So consider your licensing agency for your state, your long-term care ombudsman, law enforcement, adult protective services. If you have a hospital association, a state hospital association, definitely. The universities help, and they're wonderful with research that we don't have time to do, that we don't have the brain power to do, but they do. Consider public health, your Medicaid fraud control unit out of your attorney general's office, and some prosecutors, right? If you're going to do a great job, if law enforcement's going to do a great job investigating this and we hand it to the prosecutor, we want the prosecutors to be able to prosecute these cases and to know how to do it. So I wanted to share a quick takeaway with you guys. The action item that I picked, y'all, if y'all know me, you know I did all 4. But we started a subcommittee. That was the last thing that we did in Georgia, and this was the agenda. So this is how I started out because I was tired of us trying to be reactive. I said we got to be proactive, and we all have to address this. We all have a common problem here. So I started out with here's the statement of the problem, that we've got unlicensed personal care homes. Here's our goal for the initial meeting, is that we needed to understand every agency's role, and we needed to understand like what they can do and what they can't do. And then a reminder is that we're here to problem solve in a respectful, solution-focused manner. And I chose those words intentionally. And I recognize that each agency has limitations and challenges that we must accept for now. And that we were open to all suggestions and that no idea was off the table. Because sometimes people won't bring forth their ideas, right? Oh, this will never happen. This will never work. We're like, throw all the ideas on the table because we know what we're doing now is not working. And lastly, I want to show you, this was the map, the response map that our university partner came up with, Georgia State University, showing how different people, how different agencies respond to our unlicensed personal care homes or respond to a call that an adult is being trafficked. Look at this. It's crazy, right? It's like chaos to me, but it's a great visual because I'm a visual learner. And it helped all of us on the subcommittee understand the process, but also where the improvements were, and hopefully a way that we can streamline this. But again, partner with a university, they can do these great things that like we can't do. It really helps you understand where in the pathways that people are going through at the state, at the county, the local level, to end up in a trafficking situation, and how you can back up and look at it from like a higher level. So lastly, I just want to tell you about the National Center, and Dana, you know all this, but our mission here at the National Center for State and Tribal Elder Justice Coalitions is that we want to elevate the respect, safety, and well-being of all older adult persons by promoting excellence in state and tribal elder justice coalitions, which you have an excellent one there in Texas, as I already said. So how do we do that? We connect people together. We are the capacity builder. We help elder justice coalitions at the state and tribal level build their capacity, and we act as a national voice. So we want to know what is happening at the state and tribal level, and we bring that all together and lift it up to the federal government in a nice, concise package so that they hear what's happening there at the state and tribal level. We really want to take the coalitions from existing all the way to being effective, helping with governance, the structures of coalition, leadership of the coalition, and strengthening those cross-sector partnerships. Everything that we do is rooted in diversity, equity, and inclusion because we believe everyone should have access to an elder justice coalition. Of course, we're on the socials like everybody else is, right? So these are our socials. Please follow us, tag us in your work. Let us know what we can do to help you. You've got my email address there and the QR code should take you to our website. We have a newsletter that's coming out monthly with updates on all things that are going on elder justice. So thank you. I wish I could see your faces, but I know you're smiling. I know you're like, oh, I just took something away from this. And I hope that you did write down one thing that you can do and that you'll be able to go back and do it. But I'm here to help. If you need something, please reach out to me. And Dana, I'm going to go ahead and stop sharing. We'll see if we had any questions.
Yes. Thank you. Thank you. I did not see a peep in the chat at all, but I just gave access to everyone on the call. They can unmute themselves and they can put themselves on camera.
Oh, I love it.
So, yeah. Anybody want to let Anna see what you look like and ask a question?
Anybody feeling brave today?
Or-
It is Monday.
Anna did such a great job. Maybe you don't have any questions or you're so overwhelmed by the concept. You just aren't sure what to ask.
Dana, this is
Yes.
Pat. I don't
Hey,
have
Pat.
a question per se, but this is really an eye-opener. Like, this is a topic I wouldn't even have thought of that falls in this category. And yet I know we have a number of unlicensed homes here in Texas. And it just makes me want to reach out to my colleagues down in Austin and say, what are you finding? Because of course, we only find them when there's a problem. We don't know where the homes are.
Mhm.
They're not on a list anywhere, but great eye opener. And thank you so much for all of that information, Anna. Just like last week's seminar, it's like, oh my gosh.
Thank you, Pat. I
There's a
appreciate
lot
that.
going on that we don't know about. Yeah, thank you. Yes, Dr. Pat Gleason Wynn is on the Texas Silver-Haired Legislature.
Awesome,
She's
wonderful.
their secretary. So I don't know if you have been in a state that has the Silver-Haired legislatures or not, but
We do here in Missouri. We
okay.
do.
Mhm.
Okay, great.
Missouri started it.
Ah, really?
They're
Yep.
such a great group. So thank you, Pat. Thank you for all you do.
Thank you so much, Anna.
Anyone else have any questions or
see a
have any
question in chat.
comments? Oh, there you go.
Yeah, Angela wants to know, what can financial institutions do to identify this type of activity? Such a great question. So we worked with the Noble, if y'all are familiar with them, to help to guide financial institutions on what to look for, right? Because there's a lot of training for financial institutions about how to look for sex trafficking, right? And it's very similar. There's a lot of overlap when it comes to this type of trafficking. The key thing that I can tell you is that look if you have like one address where multiple social security checks are going to, or one person where multiple checks are going to, and multiple accounts are feeding into this one account. And if you've got the address, it may be a legitimate personal care home or legitimate facility. Don't automatically think that it's a trafficking situation, but you can go and look it up. You can look it up on your public facing website in Texas. That'll tell you if this is a licensed facility. If you don't see it on there, make a report. I mean, I am the squeaky wheel that always makes a report. But really, if you see 5, 6, 7 checks going into one person's account, that's a red flag. And we've tried to work with Social Security Administration in the past to see if they would do any data share, but that's difficult. And we tried to say, just tell us an address. Give us an idea about where these checks are going. And they could see it on their end. They could see multiple checks going to one person. So, we did this kind of advocate, educate type thing with them. So that would be my best advice for you, Angela, and other financial institutions too. Great question.
Yeah. I wouldn't have even thought of that. That is good. Did that trigger any thoughts from anyone else? Okay, well, I do want to thank you all for being here. You took the time out to learn something new, and I encourage you all to share as much as you can with other people. This will be, it has been recorded and will be posted on our YouTube channel shortly, so you'll be able to access it. I also have a QR code for a evaluation. If you don't mind, it's just a couple questions. Love to have your feedback. You can scan that QR code. I'll also send you all an email with the link. And next week, we also have another webinar, and I will put that link in the same email if you'd like to register for that. Next week will be about what Bexar County is doing and their training that they got created for frontline county workers, and how everybody had to get trained in their newly created Elder Justice Center. So hope you come back for that. So thank you again, Anna, and thank you all for being here. Last chance for questions. I know Anna is very responsive. Oh, hey, Paula, how's it going? Yeah, of course.
Hi, it's going well. I was just asking, wow, this is a great presentation. Thank you so much. I actually would love to share it with my staff. Did you record it? Is it possible to get the recording?
Yeah,
Okay.
yeah, it'll be on YouTube. I'll send you the link. Yep.
Okay, perfect. Thank you so much.
Of course, yes.
Thanks, Paula.
And if anybody else has any questions or needs anything, feel free to reach out to me. I'll have my email address in the email I send you as well. So should be pretty easy. And have a great day. You have 10 minutes back to your day. Thank you.
Thank you.
Thank you,
Bye-bye.
everyone. Bye.